Good morning to those of you who are healthy and those of you who are distant and healthy. Actually, he framed this as an epidemiological problem. I would frame it actually as a policy problem. So if time permits at the end, we're going to tackle it as a policy problem. But first, to give you a brief introduction, Dave Murday. I'm a professor in HISP. I'm adjunct. A couple of years ago, I was interim chair and actually had the pleasure of hiring Mike to come teach. So I'd like to take some credit for that. The reason he asked me to do this portion is that for 15 years I worked as research staff for the South Carolina General Assembly, the state legislature. For 15 years I was their health policy expert in various roles. So when I talk about this, it's not from, I studied it in a book, and so I'll teach you it from a book. Try to bring a little bit of the real-life challenges to you. And the other thing is, it's Monday morning. Those of you who are here may not be the most alert in the world, but I need you to be, because if I just talk for an hour, it's going to be very, very, very bad. So I'm going to start off with questions, policy questions. So the first question is, Dr. Birds and Qureshi tell Dr. Khan, now you know who Dr. Khan is, department chair in HISPM, they tell him that they are underpaid. So you all are GAs who work for Dr. Khan, and he comes to you and he says, help me figure this one out. So I want you to give me an outline. If you were going to put together a report to Dr. Khan about what he should do about this, what information would you put in that report? Don't all speak at once. Don't raise your hand.
How much are they actually paid?
So how much they're paid. What else?
Their experience.
Their experience.
The average of the market.
Pardon?
The average of the market.
The market?
Yeah, the average.
The average.
Salary of the market.
For which market? For HISPM professors, for public health professors, for university professors?
First fiscal.
For HISPM professors? Okay. Those of you who came in late, it's a pop quiz, that first question. What information would you give Dr. Khan to help him make that decision, if he has to make a decision? So how much they're paid, their experience, and what the average from HISPM professors is. HISPM budget.
And how much they get grant.
Okay, so I'll help you out there. I'll say some measure of productivity, how many grants they've got, maybe how many courses they teach. So basically how hard they work. Now we all know how hard professors really work, but for the sake of hypothetical, we'll say professors work hard. So some measure of productivity.
Evaluating their productivity based on quality, so evaluation.
Okay, so some measure of quality. Just as an aside, do you think student evaluations play any part of compensation?
No.
Actually, for compensation they don't, but you might be pleasantly surprised to know that when professors go up for tenure and promotion, student evaluations do make some difference. Do they outweigh publication, grants, and all that other stuff? I won't lie to you. But I will tell you that if somebody's marginal on the others, student evaluations can sink them. Okay, so how much they're paid, their experience, the average HISPM professor's pay, HISPM budget, some measures of how hard they work. Anything else?
Have you had any contracts or agreements starting out that may have mentioned pay, any term?
Okay. Some agreement that might have set their expectations.
Information on payment from the state rank, the state position professors from other departments.
Okay. So looking at basically comparable positions in other departments. Okay. Now take off that hat and put on your Dr. Khan hat. Somebody told you how much they're paid. You got their CV, so you see their experience and their publications and how many grants they've got in. You got your budget. You talked to other chairs in the department and they told you how much their professors paid. You got the student evaluations and you looked at their hiring letters to know what they were promised. And, you talked to some of your colleagues now for comparable, should I go to Johns Hopkins and Harvard School of Public Health for comparables? So what schools might I look at, a different school of public health to other state universities? Maybe Georgia, maybe Alabama. One of the things I learned when I worked for the state legislature here in South Carolina is that if I ever wanted to cite information from some other state, California, New York, New Jersey, Pennsylvania, Minnesota, Wisconsin, better not to bring them up, because decision makers here don't think those states have any relationship to the culture and the political decision making here. So if I said in California they did something, as a matter of fact, they're probably of a mind to think that that was a bad idea and I would sink whatever the proposal was. So, okay, so you're a decision maker. You got that information. Do you have enough information to make a decision? Anything else that you'd want to know? All right, Dr. Bird, it's your paycheck. Do they have enough information to decide whether or not you're underpaid? When the pause is that long, it's significant. Anything else you'd want the judge, jury, and executioner to know before he decided on your pay raise?
I think there's some subjective factors as well. It seems like you may have all of the objective factors here. But I think there's some other things that have to do with the department itself and their contribution to the department and maybe to public health in the community. Those are a little bit objective, a little bit subjective. So, and also maybe not so much the money that they bring in from their research, the nature of that research and its contribution to the mission of the department and the programs within the department. So I would look at those things as well. I would also talk with other faculty within the department. This has been brought up, but it bears repeating. If you had my course that I'm getting ready to teach this afternoon, HSPM 700, we're going to show a video about Adams' equity theory. And basically this is about two capuchin monkeys. Doesn't pick me up here?
We're getting you, but as
Okay, thanks.
Yep.
That got you in trouble even when you were offset.
So Adams' equity theory, these two monkeys are in...
You're giving me 1 hour. You got to give them quick stuff.
Okay, so two monkeys in the cage, and they're feeding them grapes, which they love, and all of a sudden they put a cucumber, which they don't like, into the monkey. And one monkey sees that the other monkey got a grape and takes a cucumber that this monkey got, and he throws it back out at the researcher. Adams' equity theory. So there there are a lot of factors that go into perception of equity, and the biggest thing that you can do as a manager, biggest mistake is it has some perception of inequity. The other issue is not even about other faculty. It's what if you decided to pay Dr. Qureshi differently than Dr. Bird in this? So it's a really complex decision, and so I would say there are lots of other factors as well.
Okay. If I had to say what are probably the 3 most important criteria that would influence your decision, what would those be? We mentioned, 6 or 7. He brought up some others. But when push came to shove, what would influence your decision? Budget. Productivity. Pardon? Equity. Okay. And again, so based on some sense from you, you would weight those criteria more than you might weight some of the other, like what they're paid at another university. All right, let's look at the second question. And if you don't follow Carolina football, there are probably other examples you could use, but right now Carolina needs all the help it gets, so we're taping this and we're going to send it to the head football coach, Steve Spurrier. The defense keeps collapsing on them. We've lost the last 2 games in the fourth quarter. It's shocking, except if you've been a Carolina fan for a long time, it's not really shocking. You're used to it. But so he needs to fix their defense. And so he turns to y'all. Any of you exercise science students in here? No. Okay, well then you just have to think. You're a graduate student working for the football program, and he turns to you and he says, give me some information to figure out what I need to do to fix my defense. So,
Stop using the 34.
Pardon?
The 4-3.
Pardon? Okay.
The 4-3 defense.
All right. So you would immediately say, go back to the old way of doing it. All right. What else? If Carolina loses to Furman on Saturday, it's your fault. Come on. What else what information would you provide to somebody who's trying to figure this out?
If I were him, I would first determine my personnel. So currently, South Carolina has a really good linebacker core, but their defensive line is undersized. Their defensive backs are a bit too slow. With that, I would take a look into other types of formations or defensive strategies that you could possibly do.
Okay.
So, for instance, one of the strategies that I would suggest is switching one of your extra linebackers down into a elephant position. So you're a hybrid.
Obviously, he's given this a thought.
Linebacker lineman, and so you can blitz the quarterback more effectively, and that's the way you can hide up your defensive deficiencies on the defensive backfield. And then I would submit to the head ball coach at that point.
Okay. But what other information? Because he's got Lorenzo Ward sitting right over here saying, that student doesn't know what he's talking about.
I would show him.
Now, let me get some of the. I want to. Obviously, you need to talk to the coach, and he's at what Wings place for the call-in show on Thursday nights. You need to call him and give him some advice. But the rest of you, coach has to make a decision. He's asked for information. Yes.
I may ask him to learn from others. Ask the coach to learn from other teams.
To learn from others?
Yeah. Share ideas. Willing to accept other ideas.
The amount of practice per game.
Look at practice.
Mm-hmm.
Okay, a lot of people have suggested firing as defensive coordinator. Is that something that?
It's a good knee-jerk reaction.
Okay, well, you don't have quite as much information. I'm not betting on Carolina this week if that's all the help you're going to give. All right, let's shift to, I mean, those are policy issues, and that's one of the things that I want to convey is that we think of policy in terms of public policy, so we think about governors and legislatures or senators or city council or mayors, but there's just as much policy making that goes on in the private side, and actually in some ways it's even more challenging because there are certain laws that make public policy be open, whereas private policy happens behind closed doors, and so you don't know what happens at those meetings. This is a slide that I like just because it lays out, I think it does a good job of laying out the policy development process. I sent Mike a copy of the slides, so you'll have them, so don't feel like you'll have to scribble everything down. You start with agenda setting, getting the issue onto some agenda to be dealt with, to get attention to it. Formulating the policy, and that's where information's really critical. Adopting the policy, implementing the policy, and then evaluating the policy. I will tell you from my experience, 15 years working for the legislature, a lot of people put energy into, well, no one puts as much energy as they should into number one. They put a lot of energy into 2 and 3. But one of the biggest mistakes I would see advocates make is once they got the bill adopted, everyone would high five, celebrate, and go home. But if the policy isn't implemented, or it's not implemented in the way that you thought it would be, you could be very, very disappointed. And I will tell you, a lot of people naively think, oh, just because a policy is adopted, of course it will be implemented. There's probably a policy against us having drinks in this classroom. I see I'm not the only one probably violating that policy. So the fact that a policy is adopted doesn't mean it's implemented. One of the things in particular is that very often whoever makes the decision isn't the one who actually has to do the work. And if the people who do the work think it was a bad decision, yeah, it's kind of like one of my bosses at the legislature told me once. He asked me, he said, have you gotten information on such and such? I said, no, sir, I don't have that information yet. He said, I've noticed that on the stuff you think that we need to do, I get the information like that. He said, and if it's something that you don't think we ought to do, it takes a while to get the information. And I said, yes, sir. So not just because someone decides doesn't mean something happens. And this idea of policy evaluation. Obviously, you're in school, and so you're of the mind that we ought to use evidence to make decisions. And so something that you thought was the best thing to do may not have been the best thing to do. One of the things you learn in policymaking is the law of unintended consequences. You always know what something will do, is you really don't know everything that will do. And so there were times when advocates would come and I would say, please don't ask us to pass a law. Find some other way to fix the problem. Because laws are very, very broad. So you don't pass a law to deal with a problem with child abuse in Lexington County. If I have to pass a law, because the law is going to affect everything, everybody. It's going to affect the whole system. And if it's a particular problem in an area, fix that. Please don't ask us to do the whole thing. So those are the 5 steps I think in conceptualizing whether you're an advocate, whether you're providing information, or you're just trying to understand how systems work, I particularly like this. Very quickly, just this step on policy development, just because people often ask, what do you mean when you talk about getting something on the agenda? Wow. I hope that's clearer to you than it is to me, maybe the side angle. I won't go into this in depth. Again, you'll get the slide. But basically, there are factors that affect whether something makes it onto a policy agenda. There's the media. There are certain gatekeepers or more influential people. It's kind of I work with Brain Injury Association in South Carolina, and it frustrates them no end that breast cancer, which is not nearly as prevalent as brain injury, gets all the attention and all the dollars. And why? It's actually, if you look at the factors that affect the agenda, it's personal experience. They do a better PR job. They get celebrities to endorse. Some of it may also be some stigma with brain injury, as opposed to, and there used to be stigma with breast cancer, but not so much. So again, there are a number of factors that affect whether something even makes it onto the agenda to be considered. But the real reason he asked me to come talk is this idea of a policy brief, and that is, and some of you may end up in this roles, again, whether it's in the public or private sector, it's a decision maker needs to make a decision and looks to you to provide the information they need to make the decision. It could be the CEO of a health insurance company that says, you know, under the Affordable Care Act, we need to do these accountable care organizations. What the heck do I need to do? It could be a hospital CEO. Again, Affordable Care Act says we're going to have these accountable care organizations. Should we set up our own? Should we join somebody else's? What should we do? There are always decision makers who need information, the smart ones, who need information to make their decision. And so a policy analysis framework is this kind of a systematic way of saying, okay, here's how you organize the information and then provide it to someone who has to make the decision. So the first step is to verify, define, or detail the problem. So what is the problem? What's the decision? Because I know this will be a shock to you, but not every problem has an answer. Or the decision, you may be asking the wrong people to make the decision. So what is the problem? Were they really underpaid? They all think they're underpaid. If I go ask the people who work at McDonald's whether any professor at the university is underpaid, they'd fall out laughing and then start crying. So is it really a problem? What decision needs to be made, and who are the deciders? Is this a problem best addressed by a CEO? Is it best addressed by somebody outside the organization or much lower in the organization? So once you know what the problem is, you need to figure out where is the most effective place for that decision to be made. What's the size of the problem? Again, some of you suggested getting comparable information. Again, most of you were pretty data driven. But let's look at comparables or look to see how bad is the problem. Focus on the central critical factors. I will tell you, when I worked at the legislature, 1 page. That's all we were given. You got to boil your problems and all this information down to 1 page. And everyone's like, oh, you can't do that. You come to academia where, hey, we want a 25-page paper. I first started working there. I was finishing my degree here at Carolina, and it was very difficult for me because I'd come to academia and they want a 25-page paper when I'd go back over there and they wanted a 1-page paper. And it's like, wait, You know, I got to put extra words in here, and then when I go to the policymakers, it's like I'm leaving out critical details. But that's kind of the reality of the situation. One of the senators I worked for, I busted my butt. 25-page bill, I boiled it down to one-page policy analysis. I walk in, he takes it, puts it down on his desk, and he says, "Okay, Doc, tell me what I need to know." So I had like 2 or 3 sentences. And you know what? You can't say, "Oh, it's impossible to do that, sir." It's okay. And it's amazing. It's like when I did my dissertation. Every word in my dissertation was fine. Once it was passed, committee said, "Okay, you need to pare that down for publication." Once I was passed, all of a sudden, huge sections of it. "Oh, I don't need this. I don't need this." You know, so you tend to think, okay, they need to know all of this stuff. But if forced to pare it down, you can do that to say, okay, what are the critical things a decision maker really needs to know? Identify stakeholders and their position. A stakeholder is somebody who has an interest in the decision. I learned that, you know, as creative as I try to be in terms of thinking about who might have an interest in a decision, I still would screw up. Years ago, when we were thinking of converting Medicaid in the 90s, convert it to a managed care program, the feds said, "You don't have enough managed care companies in your state." So we went out and we, basically recruited managed care companies to come to the state. And so there were 9 applications for managed care companies to the Department of Insurance to do business. And you know what? The whole move failed. And I knew the hospitals and docs would oppose it because, back then nobody liked managed care. What surprised me is Blue Cross Blue Shield killed it. Not by themselves, but as part. And I was kind of shocked. And then I realized that, all 9 companies that we were recruiting to show the feds that we had capacity, we were recruiting 9 competitors for Blue Cross Blue Shield. You think they were happy with that? No. So when you think about people who have an interest in the decision, you've got to be creative. You've got to, it's not just always the usual suspects. So if we give Dr. Bird and Dr. Qureshi a pay raise, who else might be affected by that decision who might have an interest in it? The other professors. You can guarantee that. The other HISPRM professors, of course. Certainly professors in the School of Public Health. Do you think the students might have an interest as to whether 2 professors got a particular raise? If you thought they were outstanding professors, might you voice, if they were the worst professors in the department and they were giving them a raise? How about if we increased your student fees to cover the cost of paying them? Would you then have an interest? Give you a little bit of financial skin in the game? Yeah, it's amazing how once people start paying for stuff, they start paying attention. So identify the stakeholders and their interests in it, and what power do they have? And again, I'm saying we used to have 1 page. When I came over to academia and I said 1 page, that can't be done. So you'll notice in here I say 1 to 2 pages. So you can't identify every possible stakeholder, but you better identify the critical stakeholders, because those are the ones who are going to speak up, and they'll be, people used to think as a legislative staff person I had the inside scoop, direct line to the legislators. I did, and so did every lobbyist who contributed to their campaign. So don't think that you're the only one providing information to the decision maker. So those stakeholders will also be, and you might be nice, objective, and neutral, but if it's their livelihood, they'll be probably a little bit more persistent than you about presenting their version of the facts. Okay, first one, okay, identify the problem in all its complexities. Is it a problem? What data do you have to show the problem, size of the problem? Who has an interest in it? What is that interest in? And what kind of influence do they have? The second one is for you to figure out what are the most important criteria to evaluate the decision. Okay, and there are all different. There's financial, one of those things we talked about was budget. Do we have the budget to do it? So there's financial criteria, political criteria, how feasible is it? Strategy, right. So when you, basically what you want to do is say, okay, here are the most important things that the policy needs to be able, when we say, which alternative is better than the other, you need to have established criteria to say, okay, we think this one's better because of X, Y, or Z. Those are the criteria. You guys, when you were talking about giving them a raise, you talked about productivity, you talked about quality, you talked about comparable information, and average, which gets somewhat into equity. So there are a number of different criteria you could use. And then some idea of importance, because again, you need to know which ones to pay attention to, because when you're weighing something, you know how to say, okay, these criteria are more important than these criteria. I told you, student evaluations do come into effect when looking at tenure and promotion. But I wouldn't, in terms of relative weight, probably 10%. So it's more a tiebreaker than anything. Identify desirable or undesirable outcomes. Okay? People need to know the downside. Decision makers hate surprises. I learned that the hard way time and time again. So they need to know the downside. What bad things can happen, because they hate surprises. That isn't to say that they'll shy away from making a tough decision that might have a negative consequences. They want to know what they are. They hate surprises.
To avoid resistance.
Pardon?
So you did this step to avoid the resistance of the
Well,
student.
or even letting them know where the resistance is. Sometimes people are going to oppose it. But they need, just because someone's opposed to it doesn't mean you don't do it. But again, a decision maker would want to know, okay, who's for this and who's against it, and why. That isn't to say that they're going to say, oh, no, they're against it, we won't do it, but they want to know what they're facing. What are the arguments that people are going to put against this, so that I have some idea of, no one wants to look like an idiot. So when you make a decision and somebody challenges it, you want to be able to say, yes, I understand your concerns, I thought of it, and here's why I chose to do what I did. Not, wow, I never thought of that. That never impresses voters. Okay, identify alternative. So now, this is one of those where I'm giving you, in a perfect world, you identify the problem and all that, and then you establish your criteria, and then you identify your options, and then you'll use the criteria to assess in the next step your options. A lot of times, like the gentleman over here, when the question about the head ball coach, he had all these options first. He knew, well, you could do this, or you this, or you this, and then you come back later and say, okay, if we can't do them all, what are which ones are feasible, which ones are affordable, which ones are politically a disaster. So it's always nice in a perfect world to have your evaluation criteria established before you look at options, but realistically, all of us like to skip to the solution. We hate identifying the problem. We hate looking at the criteria. It's like, oh, here's the solution. So you identify wide range of options. Status quo is doing nothing is always an alternative. I used to laugh because if I had a nickel for every time some pundit, some voter, some reporter said, they're going to have to deal with this problem, I'd be a rich man, because it's very easy for legislators to do nothing. Maintenance of the status quo is generally the easiest option. So never think, oh, they have to do something, so let's just look at stuff they do. Doing nothing is always an option, and in South Carolina, I would tell you it probably is the preferred option. I mean, the culture here is set towards maintenance of the status quo. Maybe in other cultures it's different. South Carolina, maintenance of the status quo. So doing nothing is usually a high-ranking alternative. So you have to include that on your list. You might do brainstorming in here about what the options are, but hopefully one of the reasons, again, you're taking a scientific approach to stuff is that you know the literature. It's amazing to me how many people who don't necessarily go to graduate school don't even realize there's a professional literature out there with answers, with evidence. It was very odd for me to have one foot in the policy world over at the legislature and one foot over here, because they'd be debating things over there with no information, and I'm saying, you know what, there's a whole pile of information over here right on this very topic. Of course, then I would come over here and I'd say to the academics, you need to come, present that information to the legislatures. And it's like, A, they're idiots, we don't want to talk to them, and that attitude always comes across. Or I had one professor say, because a bill was introduced, the committee needed to make a decision in 6 weeks. I said, can you come talk to me? He said, you need to give me about a year to prepare that stuff. And I was like, we don't ever get a year to figure out what to do. He said, well, then I can't help you. And we'll come to one of my political maxims at the end is, don't let the perfect be the enemy of the good. If you wait till everything's perfect, you'll never act. So you have to figure out what is the best choice, what is the best thing to do now. And as I always would tell my daughters, there are very few problems in life where you only get one chance at it. So you try it, you screw up, you realize unintended consequences, didn't work the way you thought, you come back and you fix it. When you work at the legislature, you take a much more flexible view of the world. We didn't wait to see, okay, is this the most perfect law in the world? We got it as good as we could, we get it passed. If there were problems next year, we'd come back and revisit the problem. Okay, so consult with the experts, look at the professional literature, and that will put you far. The whole policy process really doesn't have enough expertise brought in. Most of it is, whatever expertise is brought is the hospital association brings their lobbyist. And so they provide evidence, but it's evidence that supports their view. The docs come, they present their evidence. Other different healthcare providers or stakeholders, they present their evidence. So in some ways, depending on the role you provide, if you can get a more balanced view, and that was what I learned to do, is a balanced view, so that if you were unbalanced, other people would be very quick to point out your biases. So I just put it all out there. someone may not have liked what I said, but they couldn't dispute because I would have, where does that come from? Well, here's my source. Oh, okay. Okay. Redefine the problem if necessary. Okay. So the problem may not be that they're underpaid. The problem may be that they're overworked. So instead of looking at giving them a raise, maybe I don't make them teach 4 classes, be director of a master's program and do this other stuff. So always be looking at, okay, yeah, that's what I thought the problem was, but the more I look at it, it may be, here is the problem. Maybe the problem isn't the defense. Maybe it is something else. So always be flexible. Assess the alternative policies, and again, you do that based on your criteria. So if productivity is important, okay, which of these options will address that? If political considerations are very important, it does you no good to say, here is the best option that will never be implemented. You might want to tell me that as an aside, but don't put a lot of energy into something that for some reason politically would never be adopted, we could never afford. So you assess your policies based on your criteria so that you have some sense of, all right, realistically, if we brainstorm, we might come up with 10 different solutions. That's way too many. You need to boil it down to something that's more manageable, so you use your criteria to say, okay, here are the ones that are probably the most realistic and the strengths and weaknesses of each. And then lastly, because I don't know that the decision makers asked you for your recommendation, I'll end it at 5, which is displaying the options. And a lot of times this is best done visually because, if maybe you have a table, you hear about the old list of pros and cons. Well, tell me what's good or strengths and weaknesses or pros and cons of this alternative or this. So maybe you do it that way. Or maybe you have your criteria and say, okay, in terms of financial impact, this is probably the best one and this is not the best one. So you figure out, and some of this is you have to know your audience. What can, one of the things I'll show in here and emphasize is when I worked at the legislature, I used word processing, readability index stuff. I tried to get what I wrote down to an 8th grade reading level. Why? Because none of them graduated high school? No. And it really struck me the most because most of my peers as legislative staff, were either lawyers or had master's degree, things like that. Once I took a really complicated issue, wrote my policy brief, ran it through readability, shortened my sentences, used words with fewer syllables, all of the stuff that goes into readability, boiled it down, used direct sentences, not passive, boiled it down. I had more staff people coming up telling me that was the first time they had read something about it that they understood. So when you make something readable at the 8th grade level, you're not just helping illiterate people. You're actually helping people who may be a lot more literate than even you are, but who are busy, who need to be able to, I need to read this and grasp it pretty easily and quickly. So this idea of readability is important. Displaying something visually. I'm an evaluator. I use logic models to explain, okay, here's what this program is trying to do. Here are the activities. Here are what you expect from those activities to accomplish your goals. And I put that in a visual because it helps people follow a logical sequence. I could write them out in paragraphs. People grasp it a lot more quickly as a picture. So for this, use matrices, lists, charts, visual. I know a lot of times in academia, again, you're told to produce 25 pages, and so you're used to piling on the words. When you're thinking in a policy world, less words, simpler words, more pictures. Not because people are stupid, but because that helps them understand you better. Okay, for a policy brief, use that 5-step framework. You can add a 6-step, actually, which is recommendations. But you know what? A lot of times policy or decision makers aren't necessarily going to want your recommendation. They might, but they'd actually prefer, here, you do this, which is objective. And then, you know, as Senator Vern Smith said to me, Doc, tell me what I ought to do. And then I could do that. Short, engaging style, well, I wish academic papers wouldn't put me to sleep. But that's what y'all are trained to do. Make them engaging, okay? That doesn't mean you use slang or whatever, but make them engaging. Use call-outs, text boxes, pictures, charts, graphs, something to break up a relentless word after word after word after word. Okay, let me shrink the font. Can't fit it all into 2 or 3 pages at a 12, so let me see if he notices that I'm using a 10 font. Believe me, I notice, and if I've gotten older, I notice it a whole lot more. So engaging, readable. You know, have you all used the readability part of a word processor? I'll give you a clue. And you know, I read at the master's level. You know, you have your not internships. What's the final experience? Residency. The residency, you read the residency papers. Almost every one, even the good students, I'll sit there and here's a sentence that has 49 words in it. Sometimes 60 words in it. And I just highlight them. And I mean, that's cruel and unusual punishment. Don't make me. The average sentence is supposed to be, even in our kind of writing, 20 to 25 words. So 49 words. So you go back there, and if you find that it's been a long time since you used a period, go back and put one in somewhere. Okay? And that actually is one of the, readability is based on sentence length, the active or passive voice, and the syllables per word. You could say currently, or you could say now. You could say presently, or you could say now. I mean, look at the words you're using. And yeah, you know, people are like, oh, that's silly. It's like, yeah, you know what? On a word for word level, it's silly. But again, to me, the proof was in the pudding. When I had lawyers and people with other graduate degrees coming to me and saying they could understand that particular analysis. So that's what made me believe that. And so if I'm ever second reader on any of yours, rest assured, if you have a 49-word sentence, expect it to be highlighted and come back to you. Because I do run readability on it. And, you know, I may be a lone voice because here in academia they try to make things more complicated and not less. But believe me, in the outside world, public or private, people much prefer clear, brief explanations or presentations than long, complicated ones. Bottom line on all of this is, if you had to make the decision, what would you want to know? Put yourself into the decision maker's shoes. Don't think, oh, wow, you know, this really didn't fit Dr. Murday's framework, but if I were making a decision, I'd really want to add this. Well, add it. If it's something that needs to be in there for a decision maker to know, put it in there. Don't be thinking, oh, you know, this academic framework, blah, blah. Decision makers are just like you and me. What do they need to know? They hate surprises. Anything they know that can help them make a decision or live with the consequences of their decision, they'll want to know. You might say this is the best thing to do, but you also say, you know what? But if I'm wrong, baby, it's going to be tough. a different boss used to tell me, he said, Doc, legislators love people with PhDs because they don't get them very often. They just love to say, Doc. I said, Doc, why is it the Medicaid agency tells me they can't do X, Y, and Z, and you're over here telling me that they can? And I was always honest with him. I said, well, because I don't have to live with the consequences of a screw-up. So I can tell you that, yes, they can do X, Y, and Z. But if they say it and they do it and something bad happens, they've got to live with the consequences, whereas it's kind of easy for me to be in a, it's not the ivory tower over here, but I didn't have direct policy. So I could tell the legislators, yes, they can do it, and they should do it. And they're like, why are you telling me that? And the people running the program saying that it's a bad idea. Because I didn't have to live with the consequences. If it blew up, it wasn't me, it was them. So I didn't begrudge them. It didn't change my mind about what the right thing to do was. But I didn't think, oh, that agency, they just hate, they just love to maintain the status quo. I mean, you got to understand. So what does a decision maker need to know? And if there are downsides, you better make them aware of that. I just threw this slide in so you'll have it, and also just see that actually this fits into, man, I am getting older. Either that or on the angle, resolution's really tough. The slide's better in your packet. Is that actually as part of this whole advocacy, which in public health there's a good chance that you will end up doing some advocacy somewhere along your career, is that actually analyzing the policy is often just the very first step of a much longer process. So sometimes you're just helping a decision maker make a decision. Lots more times you're probably trying to figure out the best way to advocate for something, for some change. In public health, it might be individual or policy change related to health behavior or to population health or to the healthcare system, whatever. So understand that policy analysis is not just, if a decision maker happens to ask you. As an advocate, you need to know that. There are other things that hopefully you'll get into in other courses, but it's part of a much bigger picture. In politics, we often reduce things to trite phrases, and so here are the ones that mean the most to me. Everyone is entitled to his own opinion, but not his own facts. Policy brief, I always keep fact-based. I might say the medical association opposes it for these reasons, which isn't to say that their reasons are fact-based, but the fact that they oppose it is a fact. And believe me, whenever I got in trouble with a medical university years ago, because medical university in Charleston is very politically powerful. They have all the state money they could ever use. We created a program for small rural hospitals, and the medical university came in and basically tried to find a way that one of their hospitals could qualify as a small rural hospital. And so in one of my memos to the legislators, I used a reference, this being South Carolina, on about them being the tall hog at the trough, which is, kind of a big pig shouldering aside all of the other people for whom the program was designed so they could get more. And so I called them the tall hog at the trough. That memo came back to me highlighted. My boss said, "Did you really put that in writing?" "Yes, sir." So that was my opinion. It wasn't a fact. It was a memo, not a policy brief. So politics is the art of the possible, and the perfect is the enemy of the good. Okay? The biggest problem I have with people in public health is that they're true believers. And so it's like, it's gotta be this way. It's like, well, if the answer's gonna be no, if you insist on everything, could you possibly back off and take half of that? No! No, can't do that because then people will settle, we'll never get the whole thing. It's like, politics is the art of the possible. The perfect is the enemy of the good. That's the biggest problem that I would have with people from public health or the university or academics. It was one of the things, I was working with the legislature when HIV/AIDS came on the scene. And so legislators would want to know, can you get HIV from kissing? And so you'd bring a scientist in. And the scientist in his mind was going, well, you know, if the person had, you know, a bleeding sore in their mouth, and, you know, blah, blah, blah. And so they would go, well, and all of us would be going, say no, say no. And they're sitting there going, well, you know, if a restaurant, if you had salad bars and sneeze shields, and it's like, well, but should we do away with salad bars or buffets? Because if someone, and, you'd have this expert, the wheels going around in their head, well, it might be possible if, and I'm going, say no. That's where we learn to quit getting those kind of academic type experts. Because at a certain point, you have to say, no, it can't happen. In your mind, you might be going, okay, well, there is a, one chance out of a million, but you don't say that out loud because, again, if you wait for everything to be perfect, it ain't never going to happen. All right. My time's up, so I can't run you through this policy example. But just as a way to think about it, this is a very real one. I don't know if you know much about South Carolina. And under the Affordable Care Act, Obamacare, states were given the option of expanding their Medicaid program, and the feds would pick up all the costs for 3 years. A lot of states run by conservative Republican governors said not only no, but hell no. And South Carolina is in that camp. A lot of reasonable Republican governors have said, okay, well, tell you what, if you let us do it our way, but in South Carolina, it's still hell no. But, Tony's still coming?
Yes.
He's heading to Tennessee, I hear. Mm-hmm. So maybe he might even be willing to give you a reasonable discussion about whether South Carolina should expand Medicaid under the Affordable Care Act. And again, the question is, what if that's a solution? I mean, really, what is the problem we're trying to solve? What are the ways to weigh, the criteria to weigh those, identify the options? Could be expand your regular Medicaid, but in other states with conservative governors, they've used Medicaid to buy private insurance policies. They've done a number of innovative things, assess those alternatives, and then display them. There are some people who are hoping that one of the reasons that the governor said we're not going to do it and why Keck said we're not going to do it is because Medicaid is broken. Well, hopefully, under Keck's sterling leadership, Medicaid has been fixed to the point where maybe we can do it. So ask him that question. I'll be sitting in the back when he speaks, but I'm not allowed to do that. But as students, you can ask those questions. Ask him whether he's fixed Medicaid enough so that South Carolina could expand Medicaid. All right, 1032. Any questions, concerns, comments? Again, the slides, hopefully in slightly more focus, will be available to you. Yes?
Thank you very much your speech, but especially I am worried about I am for a foreigner for the system. Therefore, I am asking in the case of the public health, who is the define the policy target in the state level And also, who is the fixed with the national level all this policy? Who is the decision maker and who is the policy maker? I am very in the South Carolina example. For example,
Okay.
there is any entity or something.
Well, the whole issue of smoking in public, secondhand smoke is an issue in South Carolina. You could tackle that at the state level, and public health advocates did that, but faced a lot of resistance because South Carolina has traditionally grown a lot of tobacco. So what the advocates did is they redefined the problem and addressed different level decision makers. So rather than trying to deal with a state legislature where a significant minority of those decision makers come from counties that grow a lot of tobacco, they redefined it as a local problem. And so they came to the city of Columbia and said, can you pass an ordinance prohibiting smoking in restaurants and other public? They went to others. So actually the level of the decision maker, it may vary by the problem, or to get something done, you may have to redefine the problem and, look for decision makers who are more willing to do what you want, because one of the things, again, people fear the unknown and they don't know all of the bad things that could happen. So if Columbia adopts and did, a prohibition on smoking in restaurants and bars, I know it'll be a shock to you, but they all didn't close. But that's a fear that people played on, said, oh, if you do this, no one will come. Well, a lot of times if you can get a policy adopted somewhere, even if it's at a lower level than you'd like, and you can show that the bad things didn't happen, or yes, this happened and here was the fix. So it's hard to say automatically what is the best level. Again, because we have a Democratic progressive president, people go to the federal level to pursue change and try to skip all these Republican state level people. But I will guarantee you that in a couple of years, you get a very conservative national government, president and Congress. All of a sudden, public health advocates will be working more at the state level. So some of it is, again, politics is the art of the possible. So some problems can only be addressed at a national level. If you're trying to deal with air pollution, most of the time what fouls our air here isn't what's happening here, it's happening over there. So air pollution is something that requires a much higher level of intervention. But secondhand smoke doesn't. You might like to fix it at the national level or statewide, but in some ways, if you can deal with it at a smaller level and show that it works, that helps you advocate for change at the higher level. It will, again, it varies by problem and it varies by solution. So it's hard to say all public health issues are best dealt with at a certain level. I know that wasn't satisfactory, so follow up. Oh no, you won't hurt my feelings.
Who pays, for example, one smoking policy? The state level. Who pays? Who afford this budget?
The budget
for you have the one policy and you have the one implementation. You need the money
right
to afford this policy. decision maker, policy maker decided, yes, this is very helpful policy for our state. How to fix all the budget and implementation process? How to set all the process on the state level? It's the public health again, not the private private project.
A lot of it is context. I mean, you need to understand your decision makers and the environment in which they're working and their priorities. For better or for worse, say at the state legislature, they tend to, all right, we'll address your problem this year, but don't come back to us for another couple years, because this year we'll address whatever you think the public health problem is. For years it was infant mortality. They dumped a lot of money into programs to address infant mortality. Well, next year they didn't want to hear from public health because education was saying, you know, feed us, feed us. The highway department, I don't know how many of you drive on good roads, but I don't. And so the highway department's saying, if you want good roads, you got to give us money. And so it's not like decision makers are saying, we're not going to give public health money because we don't like them. I always used to laugh because public health folks would come in with their trump card. Do you realize that $1 spent on prevention will save you $10 in whatever? And I'm like, you don't think the highway folks have the same data that show you that fixing a highway now will save us dollars later? You don't think education has the same data that shows if you teach a child how to read in this grade, you're not paying for? I mean, you're not the only ones with those kind of data. Don't be thinking, oh, we're the only ones. So, and I mean, again, that's where just hanging out with other public health folks, you can get to thinking that the world revolves around public health. If you go down and try to get stuff implemented at the General Assembly or even at the health department, then you start to understand all the other demands on the budget and all the other stakeholders. Again, there are people after public health money that I don't even necessarily wouldn't think of as public health, but when it comes budget time, anybody who thinks that they're public health will, say, hey, I'm at the table. That's just like the medical university, this huge university in Charleston. No way in my mind that they qualified as a small rural hospital, but that didn't keep them from muscling up to the table. You can tell that one made a lasting impression on me. Question over there someone had? Yes.
I was just wondering, as a foreigner also, I don't know the special politics here, but why do Republicans oppose the expansion of Medicaid?
Not all Republicans do, and some Democrats do. Some people just think the government has too much money, and it costs money to expand Medicaid. So they're just against anything that costs more money. There are others who see Medicaid as a welfare program, and part of the culture of the South, in particular, and some Western states, is individual responsibility. You go to other states, there's more a communitarian perspective of we look after each other, whereas in the South and in some Western states, it's each person's responsible for himself, and so there isn't a whole lot of sympathy for people who they ought to get a job with health insurance. Ignore the fact that they couldn't. But so there's financial issues, there's these cultural issues, And then some of it is they just want to make the president look bad. So if the president said, you know, I want the sun to rise in the east tomorrow, they would either figure out a way it shouldn't or that it was the wrong thing to do. So, and again, I worked here under Democratic and Republican, and I wish I could tell you the Democrats were any better under a Republican president. And again, at state level, I'm one of those people who is never really was a big fan of political parties and have become less so, just because often the best decisions are never gotten to because those are they're off the table. You know, Republicans might say, we don't want to do this, and you say, well, what would you do instead? And it's like, we don't know, but that's the wrong thing to do. And so, and again, a lot of Republicans have come to recognize they need to have something to say yes to, not just no. And to be honest, the president thought by, you know, Obamacare model was a Republican, 15 years ago was the Republican model. So he thought that if he did that, he would get some support. It was kind of naive on his part.
So it is like maybe we can say like ideological conflict among the idea of sharing the cost of illness, or
I mean, yes, sometimes in the American culture, ideological sounds like finger pointing. But yet, I mean, it does come down to the values that you have and what values are more important. Just like we talk about what criteria you use to evaluate those options, actually values, whether they're personal, cultural values, really do play a huge impact on the policy process. I'm not from South Carolina, and so when I came here and got involved in the policy process, it really struck me, and this always comes out negative, but I can't think of a different way to phrase it. It was kind of a benevolent plantation mentality, which is, as leaders, my job is to take care of your needs as I define them, and your job is to be satisfied. And so it was crazy to me, having lived other places, and I would come talk to advocates here and say, why aren't you pushing that? And it's like, well, because they don't like it when people push for change. And so if we just let them know that this is bad, they'll take care of it. And it's like, wow. I lived in New Jersey, I lived in other places, and it's like the advocates never assumed that the benevolent, but I mean, that was the mindset of government. And I wish I could tell you it changed a lot in the 30 years I've been involved, but there still is a lot of this, don't cause trouble. You just tell us, and when we get the money or we get the whatever, we'll take care of you. And it doesn't work. So I always tell people get the facts behind you, but go push and push hard.
So too much government decision is not going to work.
If you're asking me what will persuade for change here, I'm the wrong person to ask Keck. You guys got a lot of good questions to ask him. Don't sit there and say, oh, yes, sir, we're so glad a powerful agency head's come to talk to us. Be respectful, but ask him. How can we make change in South Carolina? He's on his way out to Tennessee, which, but I mean, he should have a good perspective. He's all but dissertation at Tulane and in HISPM. So he has a good system perspective. He has a good public health perspective. So, again, there are a bunch of questions I'd love to ask him, but I can't, but you can. Use the opportunity. And use it not to be devilish. I might do it to be devilish, but to learn. Because, again, he knows. He knows the trade-offs and why he did things or why things happen a certain way. And the sooner you learn that, how that part of the process works, the much more effective you will be in doing whatever you want to do. So don't be shy about pushing him, pushing me, any of your guest speakers. I mean, it's critical for you to learn not just what we spout, but what will help you do what you want to do. So
It does sometimes, like, questions come up to our mind to make the ideas more clear. Why something is not fixed? Why it's been going in forever? You know, this is maybe the main drive for me or for my other student to ask such questions.
And they're excellent questions. So I think a lot of why South Carolina is the way it is because of the culture, and the culture goes back actually to colonial times. And if you had told me that before I moved to this state, that something that happened in colonial times would be still affecting policy making in the state 200 years, 300 years later, I would have just laughed at you. Having lived and worked here for 30 or 40 years, it's there. And laughing at it doesn't help you. Ignoring it won't help you. So understanding it and understanding how to use it for your advantage is critical. And at some point, maybe it isn't understanding it. Maybe it's just flat out calling it wrong, highlighting it, and pushing for change is what you need to do. But you do have to understand it, because other than that, things look mysterious. You're like, why did that just happen? You know, they don't happen for no reason. It's kind of your job as a scientist to figure out why it happened. What are you missing that caused that? Because there was a reason. We're getting flagged. I want you to know that it was a measure of some sacrifice for Dr. Bird to get me this Diet Coke. Because when I was department chair, I'd walk by his office to the Coke machine, and he'd say, you know how much sodium is in those things? And then I'd read it, and I'd say, it's only, 10%. I can drink 10 of these a day. And he'd go, no, that's not how you look at it.